Welcome back to the channel. So today we have a versus video for you guys. PD nursing versus hemodialysis nursing. For those of you who don't know, I'm Nurse Nikki. I'm a home clinic coordinator, which means that I'm a PD nurse who also runs the PD department. I started off my career as a CCHT, which is a certified clinical hemodialysis technician. Soon after, I went to nursing school and began my career as a hemodialysis nurse. And I get a lot of questions. People are inquiring which one is the best field to be in. Is it hemodialysis nursing or is it peritoneal dialysis nursing? So today we're going to go through the pros and cons of each one. PD. You get your weekends off. So that is a plus, okay? And I want to put off in quotation marks because you are on call 24/7. So even though you do have your weekends off, if you have a patient that calls you, you have to answer your work phone and you just have to help them go through whatever they need to go through. But when your patient is properly trained, you don't have any issues. Nobody's calling you. You only see them once every 2 weeks, which goes to my second point. You will see your patients once every 2 weeks after the training period is over. Initially, you'll see your patients every other day, and it depends on how fast you get through that training. So once you get through that training, then you're on your regular schedule of once every 2 weeks. The patients love it. Especially those who don't want to be in a clinic setting all the time. So most PD nurses, they like them to be in the clinic 5 days a week. But if you are not training anyone, if you're not if you don't have to see a patient but once every 2 weeks, then there's no need to be in the clinic 5 days out the week. You can do 3, you can do 4. It depends on your clinic. It depends on you as a nurse. It depends on what hours you're willing to give throughout the day, because you may have one long day or you may have several short days. So flexibility with your scheduling is pretty good with PD. That's something that I do like. More money. I'm not going to go into detail about how much money PD nurses make because it differs across the board. It depends on your personality, how fast you pick up, and how much you're willing to take on, and whether or not your clinical manager and your medical director trust your expertise. Now for me, I'm just going to say this little tidbit. I became a nurse in January of 2017. By February, I found a job. 6 months later, I was in the PD department. A year later, I was home clinic coordinator. So you do the math. Well, but everyone's different. Another key thing about PD is you have more time with your patients. And for some people, for some nurses, they like to meet new people every now and then. I love having some type of routine, and I love getting to I love that extended family feeling. So with PD, you definitely get more one-on-one time with your patients. They become a part of the family, and it's a win-win. So those are my pros and a little bit of cons for PD. Now let's talk about hemodialysis nursing. In-center. With in-center hemodialysis nursing, you have set hours. So unlike PD where you're on call, which means that your hours vary, you will know exactly when you're going to be working, and it will only be for 3 days a week. unless you pick up an extra shift, then you can do 4 or 5 if you like. But mainly, a hemodialysis nurse works 3 shifts, and it's usually anywhere from 12 to 16 hours a day, depending on your clinic and how many shifts they have. You have a whole team to work with. Every 4 patients, there will be a tech with you on the floor. And if you're in an outpatient setting, if you're in an acute setting, there will be a tech for every 3 patients. Then there will also be a nurse in that pod for the other 3 patients, but that nurse also has to give medicine to those 6 patients in total. And that's only done in an acute setting. Interact with patients in a group setting, meaning you'll have the old ratio was 1 to 16, so 1 nurse to 16 patients, but I believe the ratio has changed and dropped down to 1 nurse to every 12 patients. The patients, they all get to see each other for that shift. Everyone is in a big room. You can see the person next to you getting dialyzed. It's like one big family, you know? So group setting when you're in center hemodialysis. Easier to schedule vacations. You will always have a backup when it comes to hemodialysis nursing, because there's usually you have a Monday, Wednesday, Friday, and you have Tuesday, Thursday, Saturday. You'll rotate between Monday, Wednesday, Friday, and Tuesday, Thursday, Saturday, unless you have a nurse. I was that nurse who liked to work Tuesday, Thursday, Saturday, because you don't have any other staff, corporate staff in the building, and you don't have the added stress. So Saturdays are really relaxing when you're working in the hemodialysis field as a nurse. And if by any chance that you need to schedule vacation, you always have that nurse to back you up. Also, clinic managers, they can work the floor as a nurse. Usually a clinic manager is a registered nurse, unless it's for one other company. I'm not going to say their name, but there's one company that allows clinic managers not to be nurses. But other than that, your clinic manager can get on the floor and work as a nurse when you guys need an extra pair of hands because somebody went on vacation. Or you could do like how my clinic does. They'll pull the PD nurse, me, off my floor to work on their floor on the days that I have free. So scheduling for vacation is a lot easier when you're on the hemodialysis side. Let me just say this one last thing. For PD nursing, if you're the only PD nurse and you're the home clinic coordinator, the only person that can really cover your position is the clinical manager. Relocation is easier as well. So if you want to work at another clinic, let's say you're in Orlando and you want to, let's say for instance, move to Connecticut. You can move to Connecticut and relocate faster as a hemodialysis nurse because there's always a need for it. For PD, not so much. Usually PD nurses, they're not willing to give up their position that fast, so they're always at work, they're always working, they're always willing to work with each other to make sure that they keep their position, because being a PD nurse is pretty sweet. So, out of everything that we talked about, I must say, if I had to pick one out of the other, I would say PD nursing is my favorite. And I say that because I like having control over my time. As you can see, we have the Nurse NEKE'S coconut cakes, and that does take a huge chunk of my time that I have to spare. So, PD nursing versus hemodialysis nursing, PD nursing, you win. Remember guys, like, comment, subscribe, and share. And you too can have all the flavor minus the frosting.